pulling up on the spine in an explosive, forceful manner, trying to create cavitation or popping sound at whatever joints are going to cavitate. Hey everyone, Dr. Todd from Gonstead Spine Wellness. In this video, I'm going to talk about the somewhat controversial Ystrap Adjustment. That's where they take a strap and they pull your head up like this. So I'm going to tell you about that. You may have seen some YouTube videos. You might have heard about that. You may think you need to do that. I'm going to tell you my opinion on it because we have patients that ask us about this all the time. And I figured we'd make a video to refer back to show this to patients in the future. So before we get started, make sure you subscribe to our channel, like, turn on notifications, do all that stuff. Comment below, let us know if you've had the Ystrap adjustment in the past, if you like it, if you have questions about it, if you have reservations about it. I'm gonna tell you the feedback that I have as far as from a biomechanic standpoint, knowing what I know and what I've studied in the cervical spine, whole spine, but cervical spine primarily. I'm gonna give you my take on this. Before we get started, we serve two audiences. One is our patients. You'll see the contact info down below if you wanna give us a call and try to come in as a patient. We see people that are local here to the Meridian, Boise, Idaho area. We also have patients that fly in from out of state to see us. And we also serve a second audience. We teach chiropractors how to put corrective exercise and functional movement into their chiropractic practice. That's called MoveNowU. Check out the link below. Now let's get started. The Ystrap adjustment is where a patient's laying face up. There's a strap that's put under the chin. Well, it's like a harness that goes around the head. And it's a little bit of an evolution of just putting a towel around someone's head and pulling them up from the jaw or back in this area and doing what's called long axis distraction, pulling up on the spine in an explosive, forceful manner, trying to create cavitation or popping sound at whatever joints are going to cavitate. So I know that the implied intention of it by some practitioners is to pull up and try to cause some release between skull and atlas. So way up here, I don't have a skull piece on this, but this is atlas, the first cervical vertebra, and the condyle of the skull fits on top of that. And this is these ligaments between the atlas and the skull. That's the only thing that really connects your head to the rest of your body, is a group of ligaments, and then there's musculature. Okay, so some people do this Y-axis or Y-strap adjustment, or gross manipulation, I should call it, because it's not a specific adjustment. It's a gross movement that is literally impossible to target which joint you want to release. And I'm gonna get into that because that's part of my opinion on why I don't do this and why I wouldn't recommend that you do it. So I'll just give you a spoiler alert, I'm not a fan of this. And so if you pull up on here, it can cause a gapping between condyle and atlas. That might be some of the intention or some of the way that people have explained why they're doing this sort of gross manipulation, or even atlas and C2, or just anything and everything in the cervical spine. Some people brag about when they do this, oh, I feel it all the way down to my toes. I feel it down the entire spine. Before I get into talking about some of the perceived dangers of doing this, based on understanding cervical spine biomechanics and spinal ligament injuries, I'm going to explain how we look at what a subluxation is, and this is according to the Gonstead work. We practice a method called the Gonstead method. Our clinic's Gonstead Spine Wellness. To be clear, we do three techniques. We do Gonstead, chiropractic biophysics, and functional movement, okay? Just so I'm very clear on that. Most Gonstead chiropractors are doing adjustment only. We do a lot of spinal corrective rehab as well, which I really feel like gives me a little more credibility to be able to speak on this topic with some experience. So now a subluxation, a misalignment in the spine, trauma causes the bone to misalign backwards in most cases. That's how we learn this in the Gonstead work. We can get into all the research, and some people want to argue that the vertebra doesn't have to misalign posterior backwards first. It can be more of a rotational misalignment. At the end of the day, my training is in looking at the joint problem in that it misaligns backwards primarily. It can rotate a little bit and it can wedge a little bit. The direction of correction, the direction of thrust, is we set the bone from back to front, what's called from P to A, from posterior to anterior, through the plane line of the disc. Meaning there's a lot of specificity in the vector of the thrust in which we use when we're adjusting a cervical spine problem. That's how we're trained in the Gonstead work. So there's other techniques that will take a patient and they'll rotate the spine to adjust them to try to affect the facet joint, which are these little superficial joints. There's a capsule around there. You don't see that here because this is just bone. We don't have any of the soft tissue. We have a space where there's a disc, which is soft tissue. That's one of the ligaments that connects one bone to the next. Side note, there's 10 ligaments that connect one bone to the next. The other 9 ligaments are not pictured here, but there's ligaments that run all over the place that hold this nice and tight and stable to prevent excessive motion, to prevent joints from moving in a dangerous or hazardous manner that could cause injury to the delicate spinal cord, spinal nerve roots, or blood vasculature. So now Gonstead work, we set the bone forward. Other chiropractic techniques might be more rotational. Either way, you have some in the chiropractic spectrum that want to be more specific. In Gonstead, we want to be very specific. Specificity is king, right? That's how we were trained. We want to be very, very precise. There's other techniques that are also very, very precise. There's upper cervical adjusting techniques. There's even doctors that do more of these kind of non-protocol techniques per se, like they combine things, yet they aim to be precise and specific in their technique. I have a lot of respect for that. You don't have to do a technique name to get good results and do good quality for your patients. However, if you do the same thing on every single patient, which is called the flying 7, hit them high, hit them low, roll them twice, let them go, I don't really love that. I feel like that is just gross manipulation. That's the same type of therapy that you're doing on a patient. It's not a specific adjustment. It's not doing an assessment and evaluation to find out what segment is problematic, what segment is restricted, fixated, misaligned, to then target that segment. Instead, it's just a one-size-fits-all approach that every patient gets. In the Gonstead work, we don't do that, okay? So that's why this Ystrap thing, my question is, how do they know who's a candidate for it? What types of contraindications could there be to doing this type of gross manipulation? What kind of problems could this cause? Well, doing this sort of global pulling on the head, let's say your 7th cervical is the one that is misaligned, subluxated, stuck. I'm saying all those words because some chiropractors say the subluxation, this problem with the joint, is mostly fixation. It's stuck. It's not measurably misaligned. And then you have other kind of older models that say it's a misalignment model. The bone is misaligned, the adjustment is going to realign. From everything I've seen and learned, I would tend to side with more of the subluxation is a joint fixation issue primarily. There can be some misalignment with it that can be corrected with an adjustment, especially when you're adjusting from back to front with a lot of intentional force going into a single vertebra. So meaning I do think we can change the position of a vertebra. However, not as often as a lot of us may think, patients may think, other doctors may think, to really change alignment of the spine. That's where you're going to be doing things like postural corrective exercises and traction, spine remodeling traction, which is a chiropractic biophysics thing. That's why after years of doing Gonstead, I gravitated towards also learning chiropractic biophysics curve correction, and I've married those two together, and I've seen our results just go right through the roof. We added functional movement years later, results even got better. So that's how we take care of our patients. We address the segment, posture, and movement. To round this out and finish giving some of my opinion, the world according to me as far as the Ystrap, the reason I'm not a fan of it is because it's non-specific. There's no way of knowing what vertebrae you're going to target. In this example of C7 being subluxated, if that's stuck, if that's restricted, it takes a good amount of intention and stabilization to isolate that joint and move that joint precisely. It's easy to rattle other hypermobile segments. So what does that mean? If you have one segment that's stuck, you have other segments that have to move excessively. They have to move more to make up for that lack of motion in the restricted segment. So now if you take a Ystrap and you just randomly pull on someone's head, here's a question that I would pose to you. Do you think that that's going to target the segment that is stuck, that is problematic, and help return motion and proper position to that segment? Or do you think it's going to rattle, meaning excessively move, the other hypermobile segments that are already working overtime in an attempt to maintain normal cervical function and range of motion? The answer is number 2. When you do this, it's going to rattle the excessive moving vertebra, and here's where that becomes really frightening. Now, I'm saying frightening because I've actually worked as an expert witness 3 times. I've been hired by insurance companies to review notes and records for chiropractors who have had certain mishaps that happen, or they're accused of doing something, and I review the records and I look at it, and I have to give my expert testimony to say if I think that they were meeting the quality of care. The Ystrap thing, I would say, is very difficult to argue for that it falls under the standard of care. So standard of care falls back to, was this taught in chiropractic college? Is there any sort of research behind it? I mean, a lot of techniques don't have that, but is there research behind it? And is it the norm? Is it something that is done throughout the community? If you went into 10 different clinics and surveyed them, would they all be doing it? Would they all be doing it the same? And did they receive any formal education in doing so? And this one doesn't really pass the smell test, meaning the Ystrap thing, to my knowledge, is not taught in any chiropractic school, and there really is no specific protocol on how to do it. So it's kind of like come on in, I do the Y strap. I mean, it's something that's become trendy and cool because of YouTube videos. And I feel like once some of these injuries start to happen, it's going to be regulated more, which I'm not for having to regulate our profession. I think we should be responsible on our own and make wise choices for ourselves and for our patients. I would not let someone do this on my neck. I would not do this on a patient's neck. And the reason being falls back to something I mentioned earlier, and I'll wrap it up with this, is something called a spinal ligament injury. Now, when you injure the cervical spine, and this is something that we assess on almost all of our patients, if they have any sort of abnormal cervical curve or history of cervical spine injury, we do what are called stress x-rays. They're bending x-rays, flexion and extension. We're bending the neck and range motion, and then we're measuring each individual vertebra on how they move. So this is a x-ray study. And if those segments are moving excessively, meaning really more than a millimeter forward or backwards, combined motion, when you bend the head down, when you bend the head backwards, if it goes 0.5 millimeters forward, 0.5 backwards, you're basically at that limit of where it starts to suggest that there was a ligamentous injury, laxity, hypermobility. It's called alteration of motion segment integrity. It's a very important thing to measure, and it gives you a really good idea as far as what sort of traumas that this patient's spine has undergone. That's something that we look at on every single one of our patients. There'll be a link here above where you can watch a previous YouTube video where we went through a lot of cervical spine analysis explaining ligament instability. So back to the Y strap thing, why is that relevant? If someone has, let's say, fifth cervical is moving excessively, 3.5 millimeters, which is a grade 3 sprain, it's a big deal. And then you go and you pull on them and that segment's already moving too much, clunking around. That global gross manipulation has the opportunity to hurt that segment. It could take the segment that's already moving too much and make it move excessively even more. And that could be a bad thing. That could injure a nerve, spinal cord, blood vessel. There's all types of things that could happen from that. But speaking to my chiropractic colleagues out there, something I would just give you just some friendly advice. If that happened in your office to a patient of yours, and then that patient sued you, you wouldn't have a whole lot to fall back on because of the different criteria that I was telling you about, just serving as an expert witness 3 times now. I've learned a lot in that process, is that you have to be able to point back to some sort of, is this taught in school? Is it research? Is it a standard of care? Is it an accepted norm in our profession? And it's not. So at least right now, you know, in June of 2021, it is not. Maybe in the future it will be. Maybe everything I just said here is going to be proven wrong. Feel free to prove me wrong. If you have any evidence other than what I'm talking about, let me know. But my opinion of this is I'm not for it. I don't think it's a good idea. I would not promote it. I would not advocate it. I would not let any of my patients, family members, friends think that it's a good idea. I would advise against it. So don't want to be negative on this, but it's a question we get all the time. So I figured I would make a video, go into some detail, and give you my opinion. It's my opinion. It's the world according to me. Leave a comment below. Let me know what you think. Dr. Todd from Gonstead Spine Wellness. When it comes to the health of you and your family, results matter most.